It's 12 minutes after 8, 8:12 at North Georgia's News Talk, WDUN. Want to say good morning to one of our great neighbors, and that's Dr. Brent Sharpe with Georgia Urology. And Dr. Sharpe, we often talk about all the great things you guys do there and the new procedures that are coming out, and you're always staying right on the, and I don't mean this as a pun, on the cutting edge, especially when it comes to surgeries. But the truth of the matter is, people are traveling a long way because we are a great area for quality health care, but especially folks you're telling me are coming away as far away as South Carolina and even New York City for some of these procedures. So let's talk about something new that you've got going on there. Why are people coming there?
Well, actually, so aquablation, we've mentioned it a couple of times. That is a procedure for enlarged prostate where we use a robotic water jet to remove that tissue to open that channel so men can pee. So it's a relatively new procedure. So my partner and I, within 48 hours back in 2020, did the first case here in Georgia. We've been able to expand on that expertise, and the hospital has made the investment in the community to be able to offer this new robotic procedure that really offers men a different way to treat their prostate. It's the first time we've ever had an ultrasound in the operating room to see the man's prostate, to be able to do it for this type of surgery. And like I said, it was a big commitment by the hospital, and, you know, we've done our best to try to stay on top of this, and people have learned about us. And, again, one of our patients, let's see, last week or this week was our first week ever doing them here in this hospital, and people came from both New York and South Carolina to have their treatment here, and that's a great thing. I think our hospital system has made a wonderful commitment to the community, and I've been fortunate enough to be at 12 different hospitals in my career, some as academic institutions like Chapel Hill and Emory, and I'll put our hospital system against anybody. We do really good work here.
That is fantastic. I am curious. I want to talk just a little bit about the procedure, if I could, because when you talk about the aquablation and you're shaving some of that tissue away, how does that affect the prostate as far as its functionality?
Well, it actually doesn't affect its functionality much, because you have to remember the prostate is nothing but a fertility organ. So I joke with my, unless you're trying to conceive, you really don't need your prostate. So, but that doesn't mean we just want to get rid of all of them. But men, sometimes it can grow and the prostate can get larger and obstruct that flow, as we've talked about, and cause a lot of symptoms. But as with everybody, we walk down the street, everybody's different heights and weights and shapes and different things, and our prostates are the same way. It's not the same size in everybody, and sometimes, you know, we need a technology like this that allows us to see that prostate shape and then design a actual cutting pattern or removal pattern to get rid of that obstruction, to basically maximize the symptom relief, but also to save very important structures like the sphincter that keeps us dry. But also, a lot of men don't want to have changes in their intimacy aspects or ejaculation, and this robot will design a treatment plan that those parts can be saved so that continues after the procedure, which is a unique aspect of some of the newer minimally invasive, but especially with aquablation as opposed to your standard TURP.
Yeah, because I think a lot of folks, obviously in years past, the concern was the intimacy aspect, but also just being able to stay dry. In other words, not being incontinent and not having leakage problems. So it sounds like this addresses both of those.
Yeah, it actually does make that procedure or part safer, because once you set the robot and design that technique, the sphincter is protected not only by visualization, it's protected by the robot mounting and not moving, as opposed to within the surgeon's hands. But more importantly, if something were to fail and that robot would come back too far, so where you've set it inside to save that sphincter, it comes back in a sheath, so it can't destroy the muscle in that. So while it can happen, again, as I tell all my patients, there's one perfect person walk the face of the earth. His name's not in an MD. So we do the very best we can.
Yeah.
But building in those safety issues is key to maximizing outcome. So this is another safety feature of the aquablation as opposed to some of the other TURPs. So,
all right, I'm going to ask another ignorant question, and that is
no
right,
dumb questions.
so the prostate becomes enlarged, and that happens with age.
Yep.
It's just not a matter of whether it will; it's just when it will. and at some point it causes. How far along is a candidate to be able to have this? I mean, what are the indications? And if you're going to shave it back, will it continue to grow so you have to do it again later?
Well, that's very good points, and that's also, again, unique about the aquablation. So number one, it can grow back. We've always quoted at 10% in your lifetime. So if you're having that surgery at 50, you're a little bit more likely to have it than if you're getting it at the surgery at 80. And when a man gets that procedure, it's all based on quality of life. Now, there are a few medical absolute indications, can't pee, and it's due to the prostate. But as a general rule, it is the man is unhappy or having some issues with voiding or getting empty that he needs the procedure. So therefore, like I said, as that prostate grows, it obstructs, so we need to remove that tissue. Okay. What the aquablation offers is, again, that ability to design it to the size and to the shape, but more importantly, it can treat really, really large glands. So, for example, on Tuesday, I did 3 patients. The prostate size typically in let's say a 65-year-old man is about 40 to 60. These guys' sizes were 138, 180, and over 200.
Wow.
So these are what we kind of term as mega prostates or prostomegaly. In other words, these are really large glands. So that traditionally was either an open operation or a different robotic procedure that took 3 hours. So we took a 3-hour surgery with cameras inside your belly and put that through the penis and made it about an hour-long procedure. So we've reduced times, we've reduced risk, we've been able to treat the most difficult patients, less invasive. So this really, and I don't use this lightly, is kind of a game changer in BPH. And again, we're just so proud to be able to offer that and offer all treatment options. I'm one of the only ones doing all 8 of the BPH treatment options. It's just, again, designing a care that meets the patient's anatomy, their symptoms, and their goals, and they'll be able to roll it all into one.
That is amazing stuff. That really is incredible. And it's right here in North Georgia. People are traveling for it because it's that groundbreaking. And recovery time, what's that like?
Recovery time is actually a little bit less than your traditional TURP. Now, it does require an overnight stay right now because, again, as I said, this machine in most of our hands at Georgia Urology, because like I said, we have the largest experience in the entire country for doing this procedure. We're selecting guys that have these really larger glands because, again, things I just talked about, reduction in recovery, et cetera. So that's why they typically stay overnight in the hospital because these are the most difficult patients. But typically it's frequency, urgency, a little bit of discomfort in the prostate. There's no incisions. So it's no different than it was, if not better. And the last point is if you look at large glands like we're talking about with aquablation, it actually has been proven medically in 2 different studies to be safer than the other alternatives. So just a really winning, and again, aspect for patients. We're glad to offer it, and, again, just very proud for people to come see us.
All right, so they can come see, and you're all over the place. Gainesville, Brazelton, the hospital. Sometimes you're riding the train to get to work, whatever it is.
Sometimes I'm on my bulldozer, especially if I'm really angry and need some therapy.
So how do we get in touch with you?
Yeah, no, I'm in Gainesville and Brazelton, and people can go to our website, gaurology.com. We're happy to help. Procept is the company that makes the aquablation. They can go to aquablation.com. They made it real simple for not smart people like myself. So aquablation.com will get you information, help you find surgeons who do it, and just honored to offer it and just share it. And this is June. It's Men's Health Month. So what an exciting month to start this in. The hospital also made a commitment there to really move things at a fast pace. And we were able to combine with the hospital surgeon, Dr. Stanley, and we did this all as a unit. It wasn't about, one person or one entity. We really made a collaborative effort to basically educate staff, bring the procedure, and just make an investment in the community as a joint.
Fantastic. Dr. Sharpe, always love when you're on with us from Georgia Urology, and look forward to the next exciting step because you guys continue to break new ground. So we'll check with you in a couple of weeks, okay?
Awesome. Thank you. I'll have a great day.
All right, you too. We're 22 minutes after 8.